Welcome to the EHA2026 Perspective Congress report focused on complement-targeted therapies in hematology. As all you were aware, complementopathies are a group of disorders in which complement plays a central role in the underlying pathogenic or act as an amplifier of a tissue injury caused by other disease. At the end, the complement causes and leads to inflammation, anemia, and organ damage. In this context, complement inhibition can disrupt or can halt this underlying pathogenic disease. While PNH is the prototypic hematological complementopathy, in this group we should include other diseases like cold and agglutinin disease, atypical hemolytic syndrome, post-transplant thrombotic microangiopathy, and to a certain extent, sickle cell disease, hyperhemolytic syndrome, or warm and too-many hemolytic anemia. In all these settings, complement-targeted therapies have been proven to be efficient and efficacy, or are currently under active investigation. Throughout this Congress, some oral presentation and posters have provided us insights in complementopathies, mainly focused on PNH. As we all know, inhibition of factor V controls intravascular hemolysis and restores the normal survival in PNH patients, especially in those without a significant bone marrow failure. Nevertheless, only a minority of patients achieve normal hemoglobin levels, and this is mainly due to the treatment-emergent extravascular hemolysis. That is due to the persistent C3-mediated red blood cells opsonization. To address this clinical and mid-clinical problem, proximal complement inhibitors like iptacopan, pegcetacoplan, or danicopan has emerged as the greatest therapeutic advance in recent years. This year we were updated in some issues, for example, long-term follow-up, long-term efficacy and safety information about these proximal complement inhibitors with follow-up as beyond 3, 4, 6 years, and giving us information about the incidence and the clinical impact on the management of breakthrough hemolysis that we observe under these drugs. But we have also information about real-world evidence outside clinical trials. We have seen results of trials with other drugs, new drugs like factor B inhibitors, or bifunctional antibodies, or even combinations. Information about the results of complement inhibition in iron overload of pregnancy, and the clinical impact of monitoring erythroid PNH clone size. Some of these relevant topics are included in this report. Regarding the other hemoglobinopathies I mentioned before, several publication abstracts has given us information about the evolving role of complement-targeted therapies that are given in these diseases. For instance, cold antiglobulin disease, treated with sutimlimab, but also a lot of drugs who target B cells, crovalimab for the prevention of vaso-occlusive crisis in sickle cell disease, hyperhemolysis syndrome, the management and risk factor in these patients, how to manage or how to treat thrombotic microangiopathies, and the new great scope of treatment of autoimmune hemolytic anemias. All these topics are included in the report as well. So we hope you find this Perspective Congress report not only informative, but also relevant and most above all useful for your clinical practice. Thank you very much.